This is Understanding Addiction and Recovery, a personal development presentation by me, Jade Young. Before this class, my thoughts on addiction were that addiction was a lack of willpower, a bad habit, or a choice. I believed addicts became addicted by repeating the same bad habit over and over again, or trying a quote-unquote highly addictive drug such as heroin. The places I derived my theories of addiction were mostly from the media, such as television, movies, and books. Shows like Intervention and Cops. Movies like Requiem for a Dream and Fear and Loathing in Las Vegas. And books such as Tweak by Nick Sheff and Crank by Ellen Hopkins. I believe that addicts can get help only by going to rehab. This was reinforced by shows such as Celebrity Rehab with Dr. Drew on VH1 and books that people have written about their own experiences with addiction, such as Dry by one of my favorite authors, Augustin Burroughs, and A Million Little Pieces by James Frey, which was one of the first books I ever read about addiction. If you've ever read it, it's just a crazy story, and it was later found out to be mostly not even true. I believe that addicts had to want to get sober to get help, or they were caught with drugs or arrested for some other drug-related crime and were sentenced to rehab. A good example of this is Lindsay Lohan, who's been arrested and sentenced to about 5 different rehab centers. But in this class, I've learned that addicts are people of all races, ethnicities, genders, social classes, and sexual preference, because addiction doesn't discriminate and it can affect everyone. Addiction is a disease, specifically a brain disease. Addiction is chronic and it's characterized by use despite consequences. It can be to a substance such as alcohol, cocaine, heroin, OxyContin, Valium, Suboxone, methadone, or it can be to a process, such as an eating disorder, gambling, sex, love, shopping, video games. All of these are basically a means of coping, or rather not coping, with the individual's emotions. It is not, as I previously thought before, a lack of willpower, a bad habit, or a choice. And this is the addiction continuum. This explains how people become addicted. First, there's abstinence. The person's never tried the drug. Let's use alcohol, for example. The second step is experimentation. Drink once a month with friends. Then that progresses to regular use every weekend with friends. Eventually, this continues and the person begins to abuse alcohol, drinking every day. Abuse progresses to dependence, where the addict cannot function without alcohol, which progresses into addiction. And if the addict doesn't get help, eventually that addiction will lead to death. Long-term use changes the brain structure. Levels in the brain are changed, and depending on the type of substance, different neurotransmitters are affected, such as dopamine, serotonin, GABA, and glutamate. So the substance or process creates a large surge in dopamine in the brain, which causes a sense of pleasure or euphoria. The brain then responds by reducing its normal dopamine production. Over time, this dopamine production becomes so low that that person can no longer feel any pleasure, not even from the drug itself. The person then responds by consuming more and more of the substance or engaging in the process. Eventually, the drug or the process equals survival to the brain, and this is addiction. Prolonged use also damages parts of the brain that are responsible for judgment and decision making, which is why we see addicts making a lot of poor decisions and acting on impulse. Also, many addicts suffer from co-occurring disorders such as depression, anxiety, post-traumatic stress disorder, learning disabilities, bipolar disorder, schizophrenia. And a lot of these times, these addicts with these co-occurring disorders are using in order to self-medicate. There are several risk factors that increase a person's chance of becoming an addict. Having parents or siblings that are addicts, which we know genetics play about a 50 to 75% role in addiction. Being diagnosed with a conduct disorder, having untreated ADD or ADHD, having depression or anxiety, trauma, especially in childhood, stressful life situations or transitions like divorce, job loss, conflict at home with spouses or parents, peer pressure to use, which mostly applies to young people, and using before age 15. Addicts can get help by going to inpatient treatment, which is usually a facility of some sort that can range from 30 days to a year or even longer, depending on the situation. After inpatient treatment, it's recommended that the recovering addict go to outpatient treatment for anywhere from 3 months to a year, which just consists of group therapy, individual therapy, and meetings. Addicts can then go into a sober living or a halfway house, which ensures a safe place for the addict to go home to at the end of the day. Also, Alcoholics Anonymous, which has been widely successful with its 12-step program and its system of sponsors and sponsees. Because of the success of Alcoholics Anonymous, there have been many spin-off groups that use the same principles from Alcoholics Anonymous that are catered to that specific addiction, such as Narcotics Anonymous, Nicotine Anonymous, Eating Disorder Anonymous. There's also process addiction groups that use these same principles. They use the 12 steps and they deal with that particular process, such as Sex and Love Addicts Anonymous, Debtors Anonymous, Gamblers Anonymous, Online Gamers Anonymous. Pretty much any process that become addictive, there is some sort of support group out there to help addicts achieve recovery. So the entire process of recovery looks like after that addict has completed their initial inpatient, outpatient program, just continued treatment, attending meetings, regularly seeing a therapist so that they can manage their cravings, avoid triggers, deal with their stress so that they're not prone to relapse. But if they do relapse, there is, some sort of social support, their family or a sponsor to help them get back on track. Many addiction specialists say that relapse is essential for recovery, and some studies have shown that the more times an addict has relapsed and got back into recovery, the higher the chances of prolonged sobriety for them will be. But there are some addicts that never relapse. So the main thing that we want to stress and that we've learned from this class is that recovery is possible.